Hello, everyone. Good evening. My name is Mike Bolthouse with St. Louis Children's Hospital, and welcome to our Facebook Live event, Ask the Experts, helping parents navigate back to school. With us this evening, we have two such experts, Dr. Rachel Orscheln and Dr. Jason Newland. Both are pediatric infectious disease specialists at Washington University School of Medicine and St. Louis Children's Hospital. Before we get started, we have a lot to get to, and we want to thank those of you who are already submitting questions. Want to just kind of go over really quickly some of the framework here. So obviously, I think even when we got the wheels turning on this event, the environment, the external environment around back to school has obviously been rapidly evolving over the last several days, with a lot of the local districts going to all virtual learning to start the school year. So we will be addressing. I guess the point here is that as many people are as on this event, there are probably a unique perspective for each one of those individuals. So we're going to try and give some general guidance here. That said, Dr. Orscheln and Dr. Newland are infectious disease experts, so there are definitely topics that will be in their wheelhouse, and there are others that they will likely defer on, and certainly they will guide us on that. But we're largely talking about infection prevention and getting back to school safely, whether that's in a matter of a few weeks or a little bit later in the school year. And then wanted to give a quick heads up about as it pertains to the topics we're covering tonight. We're also looking at hosting another one of these events next Wednesday, August 12th. And the subject of that will be the mental health aspects of delaying school openings or the reopening of school for both kids and parents. So there will be more information on that forthcoming. But as we get into it this evening, we're going to open up with some prepared material from Dr. Orscheln. So Dr. Orscheln, if you want to start to queue up your screen, and I know that you've got some things that you want to talk to people about. And as we go along, I think one of the things that we've seen early on in terms of questions is, just explaining to folks why it's been so hard for all of us to keep up with the new news that seems to come out daily and the new guidance that comes out frequently on this novel coronavirus.
So thanks so much for joining us tonight and for the opportunity to talk about the novel coronavirus. So I'm going to start off and make sure you can see my slides advancing. So when we talk about the novel coronavirus, we're talking about the severe acute respiratory syndrome coronavirus 2. And we call this the novel coronavirus because we have other circulating coronaviruses. There are about 4 that cause kind of a common cold that circulate in the St. Louis region and throughout the United States every year. There are also 2 more severe coronaviruses, SARS-1 and MERS, that also can cause severe disease rarely. When we talk about the disease that is caused by the novel coronavirus, that's what we call COVID-19. And this truly is a novel situation. So we have been learning over the last few months about this infection, and our knowledge about this will continue to evolve over time. So in terms of what we know about transmission, this is primarily an infection that is spread by respiratory droplets. That means when a person coughs or sneezes or talks loudly or sings, that droplets leave their mouth and nose and then travel in the air. We generally think of droplets as traveling somewhere on the order of 3 to 6 feet, and then those can land on the eyes, nose, or mouth of another person, and that's generally how we think of this infection transmitting. It is possible that droplets can become smaller and travel farther in the air, but that's less likely to occur, and it's less likely to occur at a sufficient dose to cause someone to become very ill outside of very unusual circumstances. This virus can also contaminate objects, and so certainly if a person wipes their nose and then touches an object and another person touches that object and then touches their eyes, nose, or mouth, that's a way that it can spread through direct contact. But that is probably a minor route of spread, and this is really primarily spread through respiratory droplets. So in terms of the symptoms of the novel coronavirus, these have overlap with really all the other symptoms of illness, particularly in childhood. You can see fever and chills, although most children with this infection won't have fever. The most common symptoms we see are cough and runny nose and sore throat. You can also see shortness of breath or difficulty breathing, and then more general symptoms such as fatigue, muscle or body aches, and headaches. The one symptom that's pretty specific for infection with the novel coronavirus is this new loss of taste or smell. And then in children and in adults, you can see nausea, vomiting, and diarrhea as a constellation of symptoms that can indicate infection with this novel pathogen. After exposure to the novel coronavirus, we typically see an incubation period of anywhere between 2 days and 2 weeks in terms of when symptoms are likely to onset. It's typically around 4 to 5 days. So in terms of how children play into the epidemiology of the infection with the novel coronavirus, it appears that children are much less likely to have a clinically apparent infection. So children overall make up a small percentage of cases. And some of this is due to the fact that because they have relatively minor symptoms, they may not be tested as often. But overall, even in careful studies, when you look at the rate of infection among children, you can see that children make up somewhere between 6 and 12 cases per 100,000, and really somewhere around 5% of total cases are in children. When you look at infection, it appears that children are somewhat less susceptible to this infection. And the way we know this is if we look at careful studies of households where there was a person that was infected, and then we look at their contacts within the household carefully with nasal swabs or other testing. And we see in some studies about 4% of children of household contacts develop the infection as compared to 28% of spouses. We've also seen descriptions in communities where there's been a known exposure where children are affected at a much lower rate than the adults in the community. In terms of transmission, children, particularly younger children, seem less likely to be able to transmit this infection. Children are only rarely described as being the index case. And when they are the index case or the first person in their household to experience this infection, they seem to transmit it less than older children or adults. So it seems particularly that children less than 10 years of age transmit this infection less often than adolescents and adults. We know that adults can transmit this infection when they're pre-symptomatic or asymptomatic. And this may be true for children, but it has not been demonstrated that asymptomatic transmission has occurred from a child. And when we've looked at schools that have been in operation in other parts of the world where cases of the novel coronavirus infection have occurred, we have seen very few cases of secondary spread, particularly in situations where good mitigation strategies are followed. So when we think about this, though, there are likely to be circumstances where this infection can spread very easily. And I think we all can now appreciate that children can become infected. So in circumstances like overnight sleepaway camps, you can see transmission when people are in very close quarters with one another, when there's poor circulation or lack of ventilation in an area, where there are lots of activities like singing and shouting, and where there is a lack of use of face covering. So we know in situations where children are, where there are these different types of activities, they can become infected. If you look at hospitalizations, though, as a marker of severe illness, children are represented on these bottom lines here. Children are very unlikely to become hospitalized. Overall, I have in the inset hospitalizations related to influenza, and you can see that children, particularly young children, are hospitalized at about the same rate for the novel coronavirus. Young children are hospitalized for influenza at about the same rate as people are hospitalized overall for novel coronavirus. So certainly we see far more children being hospitalized for something like influenza as compared to the novel coronavirus. There has been a disorder that has been described in children that is a more severe manifestation, and this is called the multisystem inflammatory disorder in childhood. And this disorder has features of other post-infectious disorders like streptococcal toxic shock syndrome. We can see a similar type of presentation with some viral infections of the heart and with a syndrome called Kawasaki syndrome. This appears to be a process that occurs post-infectious. So it doesn't appear usually that the children are acutely infected with the novel coronavirus, but it seems to develop maybe several weeks after that infection. So most children who have been diagnosed with this disorder have a known exposure to someone with a novel coronavirus infection, or they can demonstrate antibodies or immune proteins to the novel coronavirus. This is a serious disorder, but most children have fully recovered because it is a treatable condition. So when we think about the mild course that most children have with infection with the novel coronavirus, we start to think about how can we get back to school. And some people have asked, well, we closed the schools down when we had very few cases in our community. How can we even think about opening up now? So I would say that in the early phase of the pandemic, we faced some severe limitations in resources. We didn't have supplies like personal protective equipment for doctors and nurses. These supplies are often produced in other countries that had supply chain issues. We also lacked adequate diagnostic testing and the supplies necessary to perform those tests. We also lacked knowledge about the appropriate ways to treat patients. We didn't know the best strategies to prevent infection and protect vulnerable individuals. And we were also unsure of the role that children played in this infection. So currently we are at a different point. We have more supplies available to us. We have more testing, although we could still use more. We've gained knowledge about a better way to treat patients. We also know better how the virus spreads and what strategies work to prevent spread. From hair salons to hospitals, we have shown that with proper screening, hygiene, and face mask usage, we are able to keep people safe and free of infection. We've also learned that children are very unlikely to become significantly ill from this infection and seem to play a lesser role in spreading this infection. And we've seen that schools, child care centers, and day camps have been able to operate with the proper mitigation strategies in place. So we know that we are in this for the long haul with this particular infection. We don't have a vaccine in we have vaccines in development. We do not have one available to us at this time. And we also understand the profound negative impact of loss of in-person schooling for children. And because of this, we know that in-person schooling can be conducted if the right situation and strategies are in place. So some of the things we need to do in order to have school in session is we certainly have to have state and local orders that allow for school opening. We also have to have protections in place for students and employees who might be at higher risk for severe illness. And then one of the really important things that we're all going to have to do prior to sending our children back to school is to be screening them carefully for any symptoms of infection with the novel coronavirus. We also need to keep children out who have a known exposure to the novel coronavirus. And this is also true for faculty and staff. So what strategies have schools been planning to open? So certainly they're planning some advanced hygiene strategies. We want to have access for children to wash their hands or perform hand hygiene more frequently. Environmental cleaning will be undertaken in an enhanced fashion. We want to make sure buildings have proper ventilation. And if we can, we leave doors and windows open. One of the critical strategies is to really reduce the number of contacts children have in school. And one way we can do this is by cohorting or bubbling children. This works particularly well with younger children where we keep them in smaller, stable groups of classmates, and we avoid mixing them with the larger school community. We know that using face masks reduces the chances of spread of infection. And we have seen, and I have been surprised by how children can really faithfully use face masks to a degree which I thought was not possible. And then we really want to use physical distancing. And so that means to the extent that's possible, we're keeping our desks and our bodies at least 3 to 6 feet apart. So one of the reasons why we do a lot of these strategies, I mentioned previously that children seem to be at lower risk of acquiring this infection, but we also want to prevent children from being considered a close contact of someone with an infection. And this is important for the process of contact tracing. So contact tracing is the process by which you identify people who are close contacts with someone with infection with a novel coronavirus. And the reason why we do this is we want to detect infection early or people at risk for infection, and we can prevent secondary cases through the use of quarantine. So a close contact is any person that was within 6 feet of an infectious person for greater than 15 minutes. So you can see in this classroom example, there would be this student, and if these students were within 6 feet for greater than 15 minutes, they would be considered a close contact. If a student is identified as a close contact, then they will be asked to stay at home for quarantine for 14 days from their last exposure. And so that's why we want to try to reduce the number of contacts our students have to reduce the chances that children will be close contacts of an infectious case and then need to be quarantined. So when families are thinking about return to school, they have to think about a number of different domains. They need to think about their individual child and their needs and risks. For most children, infection with the novel coronavirus will be very mild, and so the risk of infection to that particular child will be very low. But families also have to consider other family members and the risk to those family members. Adults, particularly those that are elderly or with underlying medical conditions, may be at more or maybe at increased risk for severe infection. And so families that have extended family living with them or have other circumstances will want to consider that when they're making a decision to return to in-person school if it is offered. Then they also need to think about the resources and needs available to the family. So certainly many families may be able to stay home and some families may need in-person schooling for their children. Also, the needs of the child should be considered in this particular equation. And we also want to think about the impact of needing to quarantine on our ability to work or do other activities that are necessary. So what can we all do to make it likely that school will be the safest place to be possible? Well, what we can do is reduce the chances that we have spread of the novel coronavirus in our community, because the lower the spread of the coronavirus in our community, the lower the chance that any person will come to school and later be diagnosed with this particular infection. So the things that we're asking everybody to do in this circumstance is to stay home when you're sick. If you have any symptoms, which could be related to infection with the novel coronavirus, we're asking people to stay home. We also are asking people to practice physical distancing. If we have distance between us and other individuals, we reduce the likelihood that infection can spread. We also want to limit our contacts and limit our time in crowds, because these are places where infection can spread more easily. We want to wash our hands frequently or use alcohol-based hand sanitizer. And it's really important to use face coverings, particularly when you're inside and in spaces where physical distancing is difficult. And then we really want to support each other. Different families will make different choices. We want to say thank you to those families who are deciding to keep their children at home, because that will reduce the number of children in school and reduce the contact number. And we also want to support those families that are choosing to send their children to school, because we will be able to best learn what strategies work best, and we'll be able to reassure ourselves that our school is going to be the safest place possible. And we also want to support our school community as we go forward. I can tell you from lots of conversations with school leaders, they have gone to great lengths to try to make the best decision for their school community, and we really need to support them as we move forward. So that is my last slide.
Thank you, Dr. Orscheln. Always helpful to have the grounding in the situation. So thank you for taking us through that. We are going to move now into questions. So the first question, Dr. Newland, is going to go to you, and this first batch are kind of in the category of questions about in-person schooling or going to class in person. So this first question is, what are the odds my kid could get sick if they go to school?
So first, I just want to thank everybody for joining us this evening. We're so excited to be able to share with you, and thank you to Dr. Rachel Orscheln, a good colleague of mine, and these wonderful slides to get us started. I think Rachel really hit on this. What are your odds? They're going to be low to get it, and they only get lower. I mean, we're talking very, very low because of all the things that we've seen people put in place in these schools, including masking for most of the children, including social distancing, including this notion that we're not going to come or have our children go to school when they're sick. And we're going to do these things. We're going to have these frequent hand hygiene. I think as a community, if our community will continue to support school and put children first, we will do the things necessary in the community to make the cases low. That makes your risk of getting sick at school even that much smaller. And that's important not only for our kids that we're sending to school, but also for our educators. Those teachers, those administrators that are doing the teaching, they need to know they're safe. And I, as well as you heard from Dr. Orscheln, believe that this will be one of the safest places we can do. But if we do the things we need to as a community, it'll make it even safer.
Great, thank you. Dr. Orscheln, this one's for you. What behaviors should parents work on with kids to help keep teachers and staff safe?
Well, it's kind of been follow-up to what I spoke about before, where the things we need to do are reduce the chances that any of us will be infected with the novel coronavirus. So that includes all those strategies: physical distancing, avoiding crowds, using face masks, using good hand hygiene, and staying home when you're sick. So when you talk about what parents need to do to prepare their children for school, it would be important to look at what type of plan your school has in place and look at what kind of strategies the school will be asking from your children. If face masks are required, which they are likely to be required for most students, especially older students, it's good to have them practice that prior to going to school. You want to make sure that when you're out in the community, when you're around other individuals, that you have them becoming acclimated. I've been really surprised. I was a little bit skeptical, I have to admit, in the beginning that young children could comply with face mask usage. But what I've seen in the hospital, where we are asking children over the age of 2 to wear face masks, is that they do it very well. And so they do it well because they see it modeled by their parents. And they also do it well because they've had an opportunity to practice it. So if we work on those things with our children, it will increase the likelihood that they will be able to do that in school. And it will also decrease the likelihood that they will become ill. This has the potential to be one of the healthiest years we have so far, because these type of strategies reduce the spread of other infections like flu and strep throat. So I think by doing these things, practicing these behaviors, we can keep everybody safe and healthy at school.
Yeah, it's amazing how well they wear the mask. I agree. I was in a clinic today, and I saw this little, like, probably 3-4-year-old walking in with this cool mask on. Now they get these really cool masks, and I think we sometimes underestimate and even underestimate our high schoolers and middle schoolers about how well they can do if we just support them and role model, as Rachel said.
Thank you both. The next question, Dr. Newland, goes to you. It's a good question. What role do county health departments play in helping school districts make these decisions?
Yeah, our partnership with our health departments is critical. I mean, our health departments are reviewing cases, seeing the data, identifying where there might be opportunities that we improve. They're allowing us to see and do some of the contact tracing we need to do. Now, their job has been made very, very difficult at times because of the number of cases that we're seeing. And so the more cases that we have, the less likely they're able to get the information in a quicker amount of time. And so I think the health department will be critical, and we'll continue to partner with them as they provide us this data. And more importantly, I think as parents, we need to be, doing our job to limit the number of cases, because that makes the job easier for everybody, including the health department.
Thank you. Dr. Orscheln, this is a good question too about the word exposure has become very prevalent. This person is asking, what technically constitutes an exposure? If my child is around someone who was exposed, should I have them tested? And what does that look like?
Well, that's a great question. So, what constitutes an exposure is being within proximity to a person for a certain amount of time. So we generally say if you were within 6 feet of an infectious case for greater than 15 minutes, then that's considered an exposure. If you're, someone coughs in your face, even if it's only briefly, that could be an exposure as well. And certainly any household contact that you have with an infected person, that would be considered an exposure. If your child is around someone who was exposed, we don't necessarily consider them exposed by association. So, certainly if you're around someone who has an exposure but wasn't known to be infected, then that doesn't necessarily count as an exposure for your child. If your child has a true exposure, then sometimes people wonder, should they immediately get them tested? And we generally say, for most circumstances, we wouldn't test that child. We would instead ask that they be quarantined. And if they develop symptoms, you could consider having them tested. And the reason for that is, even if you're tested at one moment, it doesn't necessarily mean that you're negative for good. So I told you that the incubation period is somewhere between 2 and 14 days. So if you get tested at day 7, that doesn't mean you won't be positive at day 8. So we generally say that anybody who has an exposure to COVID-19 or a person with this disease, that they would quarantine for 14 days.
Thank you. We had one come in as a follow-up to the conversation we just had about giving kids credit for taking on the masks a lot easier than we might give them credit for. There's a question about, are there specific types of masks that you recommend for kids?
Well, we say that whatever mask they'll wear, that's a good mask for them. So if you want to know whether a mask is effective for your child, some things you can do to sort of test them out are you can actually hold them up to the light. If you can see a lot of light through the mask, they may not be as protective as we would like. Also, if you can put on the mask and blow out a candle, that might not be as protective as we would like it to be. So in general, if a child really likes the mask, then that's probably a good mask. If it fits them well over their ears and stays in place and is comfortable, then that's going to be a really good mask.
Okay, thank you. And Dr. Orscheln, we'll go back to you with this one. This is someone asking if basically what happens if a student would test positive for COVID-19.
So when a student, let's say develops symptoms in school and goes home and then is seen by their primary care provider and then ultimately has a positive test, then what will happen is the school and the health department will work together to determine who their close contacts were. Schools have been planning for this type of situation to occur because we know it is very likely that a student will be in school and will be later diagnosed with infection with the novel coronavirus. What they'll do is they'll actually look back 2 days before the student developed symptoms, and then they will look to see who were the close contacts of that student. They'll do that by looking at seating charts, they'll look at classes, they'll look at bus routes, and they'll look at activities, and they'll determine which students would be considered close contacts. That list of close contacts then will likely be contacted by the local health department, and there will be a determination made about whether those students truly were close contacts and whether they need to be then quarantined and out of school for 14 days from their last contact.
Thank you. Dr. Newland, parents who are sending their kids back to daycare, what should they be considering or thinking about?
Well, daycares have been proven to be extremely safe. Number one, even our daycares and early education centers that have been opened, some have been opened throughout the pandemic. Most had done great success without any transmission. So like Dr. Orscheln mentioned here at the beginning, what are some keys? Number one, we're not going to take our children to daycare if they're sick. If they're having these symptoms that we know are associated with the novel coronavirus or this COVID-19 illness, like fever, runny nose, cough, we're not bringing them there. We know that's not the case. If one of us in our family has been tested for coronavirus because we're sick, we're not bringing our kids because they're exposed. These sorts of behaviors by us will do that. But again, we have so much data about the daycares in our own community, daycares in New York City during the height of the pandemic, when they were the hottest place on the country for COVID-19. They've stayed open and they've done an extraordinary job of preventing the transmission. So I'm all for the daycare centers. I'm all for these. They have done amazing work, and I think you're definitely safe to have your children go there.
This is one coming in from the live audience. Should parents who send their kids to school in person quarantine those kids from other families, from other kids, other family members? Basically, should they quarantine kids they're sending to in-person classes?
Well, I think here's the thing. Those kids are going to be in an environment that is going to be really safe, and we're going to learn that more and more. Now, do they have more exposures than the child that stays home and doesn't around anybody? Well, yes, absolutely. They have more opportunity to potentially get contact that. But if they're wearing their masks, if we're not sending kids to school, then I think that we know that the risk is going to be low. And that's what we're going to see. If someone's like, look, they're going to school, they're around a lot of kids, and they're like, I'm just not going to have them around some of those that are in vulnerable groups, like the elderly, that's understandable at this time. But again, I think as Dr. Orscheln has mentioned, schools are going to be safe. And if we as a community do what we're supposed to do, we'll decrease that transmission in the community, decrease the risk in the schools, everything in the schools will be safe. We know there's a lot of activity that's going on even currently with our kids that maybe won't even be in school, right? That they're going to go be a part of large graduation parties, which, by the way, hurt one of my kids in the sense that they got exposed, and that wasn't fun. But these large gatherings right now are not necessary. If we do that, we will be doing what we need to, and it'll make the risk low wherever you are.
Okay, thank you, Dr. Orscheln. This is playing off of a part of the conversation earlier. It may be a repeat question. It may not be, but I'll leave that to you. This is asking if a child has COVID but has no symptoms, how likely are they to transmit the virus to their teacher or others within the school?
That's the $50,000 question. What we have not seen is documentation that an asymptomatic child has spread it to an adult. We haven't seen that, documented in the medical literature. It doesn't mean it couldn't occur. It just is probably very unlikely. especially when you talk about the kind of strategies we're going to have in place, like, keeping kids who are coughing out. Now, that wouldn't be an asymptomatic child. We are going to have distancing. We're going to have face masks for everybody. So I think in those circumstances, it's incredibly unlikely that we would see asymptomatic transmission from a child to an adult. Now, there may be circumstances where that could happen. And one particular might be if you had, let's say, a teenager who was shouting or singing loudly directly into someone's face. Even if that person was asymptomatic, I believe that is very likely they could transmit viral particles onto another person. But for the most part, we have not seen documentation of spread this way from children to adults.
Okay, thank you very much. And then one more that has come in here, and hopefully I didn't lose it. Here it is. Kids with asthma, should they or shouldn't they go?
Well, it's always important for every child, every family to talk with their healthcare provider, because we can't make a uniform recommendation for everyone. What I can say is that we think that these children are not at greater risk than, let's say, they would be for other respiratory viruses. At least at this current time, it does not seem to be the case. So if a child is otherwise going to school during cold and flu season, it is likely that it will be safe for them to go to school in the current environment. But it's always important to have that conversation with the person's primary care provider.
Yep. And when we've talked to our pulmonologists, that's exactly what they're saying at this point in time. Absolutely. So that they can. It's just that it's that decision with the families.
Okay. Thank you. We're going to shift a little bit to the topic of distance and virtual learning, which we're all becoming experts in. So Dr. Orscheln, or attempting to. Dr. Orscheln, this one's for you. The individual is asking, my children are learning virtually at home, but kids in their orbit, friends, neighbors, etc., are going in person. Do I need to limit or prohibit contact with those friends once school starts?
Well, this is a circumstance where every person's individual circumstance is different. In general, obviously, the more contacts anyone has, the increased likelihood they will encounter someone who has infection with the novel coronavirus. In general, when we're talking about friends and our children, we know that contact with other children is critically important for our own children's development, for their happiness. So when we think about interactions, we think about things that will reduce the chance that there will be spread. And that includes things like making sure nobody's sick when they're getting together, doing activities that are safer. So that would be things that are outside, things that are physically distanced, doing activities with face masks on, doing activities with smaller groups of limited contact. So sort of having a small social sphere. That just reduces the overall chances that any person will encounter someone who has infection with the novel coronavirus. Like we've said, I think several times already in this talk, it's, the schools, if all the strategies are put in place, are going to be a place where we're hoping not to see a lot of transmission, because these strategies have been shown in other settings to be effective. We've seen that happen in childcare centers, where you can really put these strategies in place and they can be effective in limiting the chances that anybody becomes infected. So I would say overall, though, we are still in a period where we want to reduce our number of contacts, and we want to try to limit ourselves to those activities that are the safest.
Okay, thank you. This one I'm definitely interested in as well. It's a great question. If my child is Dr. Newland, if my child is taking classes virtually, can they still have study groups with friends?
I think this goes to just what Dr. Orscheln just kind of mentioned. Of course, if you want to get rid of all risk, there is no study groups, right? And you do this maybe you do Zooms that's their study groups. They can do it virtually. You can take the risk a little bit more, right? And you can put them in the small group, hopefully being, 3 or 4, not 10 or 12, depending on what you want to call as small. I mean, we're talking, I would say, less than 5 or 6 for sure is small. You can do that in a masking, distancing fashion. And then you could go to just give yourself a little bit more risk, as Dr. Orscheln mentioned, is that, you keep the sphere small. You got your bubble and you got your smaller bubble. And so, if one of the people in the bubble get sick with the novel coronavirus, well, then the bubble is exposed, right? And they need to sit down. So there are levels. You can take into account the family situations and those things. So I'm not going to say, no, you can't do it. I think you just have to understand that risk. I will tell you, my own children, I have 3 teenagers. as does Dr. Orscheln, by the way. And they have their bubbles. They have their groups of friends, and their dad is, as you can imagine, is very nervous about them all the time. And I say, look, you're wearing your mask, and I don't want the bubbles being interrupted, and you got to understand those risks. And so that's what I think we have to do. And I think that goes to kind of even this small group studying scenarios.
Okay, thank you. Circling back around a little bit on the subject of masks, this one's fairly specific, Dr. Orscheln. It says, I see lots of masks marketed as quote unquote cooling material that I think we're talking about the neck gaiters potentially here. They can be pulled up and down over your face throughout the day. Are these safe? Should there be a certain number of layers in a mask?
Well, we generally want our masks to not be, again, a thing that you could blow a lot of air through or breathe a lot of air in. So, if you want to try to see if a mask is likely to be protective, you can hold it over your face and see if you can blow through it. If you can't, then it's likely to be fairly protective against, none of these things are perfectly protective, but fairly protective against transmission of the virus, either to you or from you to someone else. They're generally safe to wear. Masks are safe. People have made questions about whether you'll have a buildup of carbon dioxide in your body. And generally speaking, this is not going to happen through the use of face masks. We do not have them sealed around our face. They're not impermeable. And so they're definitely safe to wear. And then how protected they are depends on the type of material. And you can do some simple tests to see how likely they are to prevent your breath from going out or something from coming in.
Thank you, Dr. Newland. Dr. Newland. This one's about exceptions. What mask exceptions are appropriate for school-aged kids?
Well, first, most school-aged children, actually, the 99% will do fine with the mask. Now, I know there's probably some others. Whoa, my kid gets really anxious with the mask. I think we definitely know there is some anxiety, but that can be taught to and worked on, and that's where this role modeling, I think, Dr. Orscheln mentioned this earlier, let's start getting into that habit now. Now, there are some children that might have, some severely with sensory issues that could struggle with the mask, and I think, but for the most part, there will be a rare exception for masking, and I think when we look at kind of the benefits of masks based on what we've heard already in the great presentation, as well as I know there might be some people here from Springfield, Missouri watching. I mean, Springfield, Missouri has the case of the great clips with the hairdressers. We know that's protective when those were cloth-based masks. So we really need to kind of work toward that. But again, it'll be rare exceptions, but for the most part, everyone should be able to wear a mask.
Great, thank you. Dr. Orscheln, how can parents discuss wearing masks or social distancing with young kids? This person asking for someone in the 3 to 4 year old range.
Well, again, I've been impressed by young children being able to do this, and it really is a matter of a couple different things. One, when they see their parents do something, they're going to more readily accept doing it. So it's that role modeling. And then it's really practicing. So having your child wear a mask for short periods of time, have them have some agency in choosing the type of mask they wear. I think that can be very helpful. And really talking about that we do this to protect other people, and it also provides some protection for us. And kids are generally very altruistic and they want to help other people. In terms of social distancing, that's a little bit trickier with young kids and may not be as necessary, particularly in the school environment for children to social distance. So we can talk about things like, keeping our arm's length away from people, but we are likely to allow young children particularly to play together, and we don't want to hamper that too much. And so certainly in certain circumstances, maybe on a public playground, we might want to say, hey, we're going to keep our airplane arms out so that we're not getting so close to other people. But in a school environment, we're generally going to let young children play together, and we're going to keep them cohorted. So really their contacts are limited based on the fact that they're with a limited number of students.
Okay, thank you. We have a couple more that have come in from the live audience here with regard to masks. The first one says, should kids wear masks outside like at recess? And I would add to that, I know that there's been some things out in the news over the last day or so that have talked about potentially wearing them inside now too, depending on the situation within your family. But so I guess mask wearing outside of what we've traditionally been considering our bubble up till now. Any advice for listeners on that?
Well, generally speaking, we're not. Oh, you want to go ahead, Jason?
No, you got it.
Okay. Generally speaking, we do not think masks are as necessary when we're in the outside environment, when we can be physically distanced. And we do know that kids will need a break from wearing a mask. They're not going to be able to wear them continuously throughout the day. And so really the outdoor environment for so many reasons is the best place for that to happen. You can have greater physical distancing between people. You have enhanced ventilation when you're outside. And so when we look at where transmission of this virus takes place, it's typically when there have been outbreaks or clusters in the inside environment. So really the outside is a good place to be and have your mask on, and we need to have those kind of breaks. With regard to the question of should you wear them at home, there are certain circumstances where that might be appropriate. If you have a known contact in your household, we know that wearing masks can reduce the chances that there'll be secondary cases. Now, I think that's probably impractical for most of us most of the time, but in certain circumstances, it could be recommended.
Okay, thank you. And then this next one on masks says, my child's school isn't requiring kids to wear masks. What can I do?
Jason, you want to take that one?
Yeah, that's a challenging situation. We understand. I think they might not be requiring it, but I know many are having recommendations. And I think from what we have seen, we have evolved as we watch this, is that masking is a good thing. I mean, we know that there's a lot of upside. We don't know of any of the negatives yet. I mean, we've heard of people, maybe they're going to chew on it or trade it, but that's not giving the kids the chance. So if they're my kids, I'm like, hey, you're going to school, I want you wearing the mask. And I think we should continue to support that, support our educators and teachers about the masking, because most likely they'll be in the mask and they'll feel a lot more comfortable if we're all masking and making sure our children are doing that as well.
Yeah, I think that's particularly a good point. We really want, especially the adults in the environment, to be wearing a mask. When we have seen transmissions occur in either childcare centers or in schools, it's often from an adult. And so really making sure all the adults in the environment are consistently wearing a mask is going to be really critical. And then probably the need to wear a mask increases with increasing age of the student. So really, I think those high schoolers, they're much like adults. And so their ability to transmit and to become infected are similar to what happens in adults. So we really want to focus on those age groups, particularly for wearing masks. They also have a lot more contact. So when you look at students and if they can be bubbled or with a small cohort, that's pretty easy when you're in kindergarten. You can keep 15 kindergartners together all day. Maybe the use of a mask is less critical in that sort of circumstance. When you're talking about a ninth grader, they may have class with a number of different rotations in it. And so they're going to have different students that they're exposed to. That's when we really want to focus on the importance of wearing a mask consistently.
Okay, well, that's actually a really good segue to a question that just came in from the audience. Just for clarification for this specific question, the question is it more likely for an adult teacher to pass to a child?
Yeah, it does seem so in circumstances where a transmission has taken place. In general, in a variety of different settings, it typically is from an adult to a child. And that is just something we don't completely understand, whether it's related to the force at which they can expel the virus. It doesn't necessarily seem to be related to the quantity of virus. There was a recent study that came out that looked at children versus adults, and they have similar amounts of viral RNA. Now, we don't know that means it's virus that can infect other people necessarily, but there does seem to be something different, particularly about young children, in that they don't seem to spread it as easily as teenagers and adults.
Yeah, interesting household contact studies where they've looked at the index for that first person sick in the home. Most of those scenarios are the adult is the person, and then they give it to the child. And those we've seen that in a number of different studies.
There's also been interesting descriptions of children who were infected and then had lots and lots of contacts and really don't infect or infect very few to no other individuals. So again, we will need to monitor this situation, especially as we're having more children in school. We'll need to be vigilant for detecting cases and having strategies for picking up clusters of cases in any circumstance. But thus far, it seems that it's unlikely that children spread widely, particularly young children.
That's all really good information. This is switching a little bit to, I'll say broadly, the idea of surfaces. This one is asking, there's a couple of related questions. The first one is it safe for teachers or kids to touch or share supplies? And then the other one is very straightforward. Does the virus live on a surface, and should kids be bringing things like backpacks and so on and so forth? Are they, I guess the question of what this person's getting at is, are they more exposed by bringing their own stuff to school?
Well, we've been saying like we're going to try to limit our sharing. This isn't the time where we're going to be sharing a lot of stuff. Now, does that mean you can't share anything? No, we're not saying that. And how do we mitigate or prevent any transmission is we really focus a lot on our washing our hands and doing it effectively. And so if I am going to give someone something, then there's going to be some hand hygiene built into that. But for the most part, we should not be sharing, our pencils or those things that we've always taught them to do. Now, bringing the backpack, yeah, you can bring your backpack and put those where they need to be. It's just we're trying to limit some of that sharing. But lastly, just to stress, the main way this virus is transmitted, is person to person, kind of being in kind of our respiratory droplets, as was Dr. Orscheln so nicely described earlier. That's how you're going to see it transmitted. But it doesn't take away the fact that we need to wash our hands, wipe down some of our surfaces to be cleaner than we ever have been.
There has been concern that, and it has been demonstrated that, let's say when a sick person's in the hospital, you can find the virus in their environment. It's not always clear that you can actually take that virus and infect someone else or grow it in the lab. So it does not seem to be that you can, even if you can find the virus on surfaces, that you could readily then take that virus and infect other people. So again, inanimate objects, contact transmission is probably a very small way that this virus is transmitted. And again, it's most likely to be transmitted through that droplet, close proximity to another person through the respiratory route.
Thank you very much. We are coming up on about 10 minutes remaining. We have about 6 to 7 more questions. So we're going to try and plow through these as quickly as we can. Dr. Newland, this next one is for you. If in-person classes are okay in my community, what other activities are okay?
Well, I think in-person class and what's being happened in schools is what we're stressing to do whenever you go out to do any activities, right? So we're talking about in-person school. You're wearing a mask for the most part. You're doing some social distancing. We're washing our hands. So activities outside, I think, is the same similar things, right? We're going to limit any major gatherings. We're going to do our social distancing. We're going to wear a mask. Now, for children, we're talking often about sports. Well, can they do sports? And I think what our sports clubs have done and sports organizations are doing is some similar things. And as we learn more about that, and as our case level drops, not the case level we're having now, we'll be able to do more and more things. And so, but again, we have to use some of the similar principles outside. We don't show up when we're sick. We're washing our hands. We're wearing our mask, especially in these crowded areas. We're avoiding large real large, like private parties, these sorts of things where we see a lot of the transmission.
Thank you. Dr. Orscheln, someone wants to know, actually there's a couple of somewhat related questions here. So the first one is, should siblings of immunocompromised kids be allowed to attend school in person? And then we had one come in from the live audience. Let me see if we can find it here. Are kids with diabetes more at risk?
Well, I can say to the second question, it appears that children with type 1 diabetes, which is the most common type of diabetes we see in childhood, that they do not have an increased risk of infection with the novel coronavirus. In terms of any siblings of immunocompromised children or those immunocompromised children themselves, generally they should be speaking with their primary doctor or their specialist regarding the appropriateness of that child going to school. But what we have noticed is even the children we have seen with immunocompromising conditions, children with transplants, either hematological stem cell transplants or organ transplants, they have done quite well with infection with the novel coronavirus. So it may be that if you would otherwise keep the siblings home during cold and flu seasons, you might do it this season as well. But if you wouldn't otherwise, then it may not be necessary due to infection with the novel coronavirus in the community. It may be that we're going to have reduced transmission overall of other viruses, and so it may be safe. But really, the most important thing is to talk with your healthcare provider about the appropriateness for your family.
Okay, thank you. Dr. Newland, a couple of related questions here. The first one is, are the symptoms we should be watching for different in kids? And then related, this question says, if a child has a runny nose and a cough, will they be sent home? Are there other more definitive symptoms to help school staff decide cold versus COVID?
So this is what's on all of our minds, right? How do we distinguish who's the COVID-19 illness versus the other respiratory viruses that Rachel mentioned, and that we see every winter, fall, and we deal with. So what do we know about the symptoms of the novel coronavirus? Well, we talk about fever. Well, fever is in less than half of them. Runny nose and cough seem to be also somewhat common, but we've also learned about some will have vomiting and diarrhea. Some will have this loss of smell or taste, which does seem to be more specific. And so what do we need to do? Well, I think for this coming year, it's a lot different, right? If we're having illnesses, these kind of respiratory viral-like illnesses in our schools, the first thing we have to think of is the novel coronavirus, because of how well it can transmit to others and because of the risk to our loved ones. And so if a child has runny nose and cough, those two symptoms, especially cough, and those are definitely new and not related to allergies that our doctor hasn't said, then that individual need not be in school. And being that our testing by this point is going to be awesome, you will be saying, hey, we're going to get them tested so that we know. And that's going to be important. And then we're going to also be saying, not come back to school until those symptoms are improving. And so it's going to be different this year. And we as a community and a society have to realize that, if I have my runny nose and cough that just started because, my 2-year-old has it, I'm not coming to work, right? Because that's not what we need to be doing right now. And so this is going to be new for every one of us. I'll be the first to admit I have come to work with a runny nose and cold when I probably shouldn't have been here. And this year I can't do that. So that's what I think we have to keep working. It's going to be challenging, but I think we have some things in place that will help that.
And I think it's going to be challenging for schools. I think when we have children develop symptoms at school, most of the time it's not going to be infection with the novel coronavirus. So we don't need to act at that very minute. There have been questions about whether if a student at school develops any symptoms, a fever, a cough, runny nose, should all the students in their cohort or what would be considered their close contacts be sent home as well? We generally would say no to that. Those children should be seen, evaluated by their primary care physician or provider, and have testing as appropriate, or an alternate diagnosis may be made. And only in the case that they're diagnosed with infection with the novel coronavirus would then we activate the detection of close contacts and then quarantine as appropriate.
Well, you just answered the next one partially. So this is Dr. Orscheln, if someone in our house, well, actually slightly different. If someone in our house is positive and my child has to get tested, where do they go? Will they have to miss school while we wait for the results, or until the positive person is better?
This is one of the trickiest situations, because when you have a household contact who is infected with the novel coronavirus, you actually have to wait until your last exposure with them. So if you're living together, that's about day 10 of their illness. And then you need to be quarantined for 14 days after that. And so even if a child gets tested, they're still going to need to be quarantined for that long period of time. So generally speaking, we're not having the child tested unless symptoms develop, because then that would actually potentially shorten their time of quarantine, or of isolation, because your time of isolation is generally 10 days from your positive test or symptom onset. And so in most circumstances, a child is not going to school if they have a household contact who is positive, and instead they are quarantining at home until they're 10 days, until 10 days of that person's illness, and then 14 days in that incubation period. Now, there are a variety of locations where people can be tested in the community. I'm hoping that maybe we could post some of those sites. Generally speaking, health departments have some testing that's available, but there are various testing locations throughout the city and certainly the state.
Thank you. This one's not necessarily. Well, maybe it is. I'm gonna ask it. So we've got several people who've weighed in on the subject of screen time, right? And then the question here is primarily around the virtual learning. Are there any concerns as pediatricians? There any concerns with the amount of screen time kids are going to have associated with virtual learning?
Well, there's always a concern when children have to be sedentary. And so I think that's one of the issues with virtual learning, is that sometimes that results in increased number of hours of the day where a child is sitting. And certainly if you're not in a school environment, you may be sitting more. So I think that's one particular concern. I think, certainly there are other considerations for virtual learning. Some young children children with developmental disorders, children with limited access to internet may not benefit from virtual learning. So there are those considerations as well. In general, though, with really high quality virtual learning, if a child is engaged, and particularly if they have someone to supervise that activity, it can be very robust. And I think our schools and our school leaders have been working very diligently to try to maximize the benefit of virtual learning, because it may be necessary even if families don't choose that as their primary option. So we know that if a child is sick, we're going to ask them to be out of school for a longer period of time than we would in the past. Certainly if someone has a contact, either a family member or a school contact, and they're considered a close contact and need to quarantine, that could be 14 days out of school. So I think schools have been working to make that online virtual experience as robust as possible for all the different circumstances.
Okay, thank you. Two more quick questions, and then we're gonna go ahead and wrap it up. This next one actually asks, is there such a thing as over hand sanitizing or over hand cleaning?
I don't think in this time we can overdo it. I mean, I think for the most part, we're going to be, washing our hands or using hand sanitizers in our typical times before we eat, after we use the bathroom, after we eat. But I think you will do it some more, right? Maybe in the school setting, they're going to hand sanitize their way into the room. They're going to hand sanitize their way out of the room. They're going to hand sanitize their way into these different things. And we just have to think that we need to be clean and cleaner than we ever have been. And as Dr. Orscheln said, I think it might be the safest summer or safest winter and fall that we've ever seen in regards to school when it comes to respiratory viruses.
Okay, and the last one here, Dr. Newland in particular, I think you'd mentioned we're headed into the fall and cold and flu season. This person is wanting to know, as we head into that season, is there anything that we should be doing differently given the circumstances in terms of getting well checks, flu shots, et cetera?
Well, I would like to emphasize the importance of getting flu shots. We've seen in other parts of the world that have made a really big push for influenza vaccinations, that they have seen a really dramatic decline in cases of influenza. And that's going to be really important because influenza has a lot of overlap with symptoms with the novel coronavirus. And influenza, frankly, is probably a more serious disease for children. And so we really want to do what we can to prevent influenza. And that's going to include getting flu shots for as many people as possible.
Okay, great. Well, we're right up against our time for the evening, and we want to be respectful of your time and of the audience's time. But as we bring this to a close, I'd say first and foremost, Dr. Orscheln, Dr. Newland, thank you very much for taking the time. We know we had a lot of interest in this session in particular, and taking the time to share your expertise and insights on this topic with the viewers. Is there anything that you would like to offer listeners and viewers here as we wrap it up?
Well, of course we would do this. No, you got to end it, Rachel, because you've done so much for this and really have led the charge here. I would just say that as a community, we have to just we have to be together in this. And what we as adults do and our behaviors outside will matter. And those behaviors will allow our kids to get back to school and be even safer at school. So I just hope we all remember that as we get ourselves closer to school. Sorry, you end it, Rachel.
Absolutely. I just want to follow up on what Jason said. Everything we can do to reduce transmission in our community will make our schools the safest place to be. And also everything we can do to keep people healthy. And that's going to include things like not coming in when we're sick, getting our influenza vaccine. Those are the things we can do to really make sure our school year is going to be the safest one possible.
All right. Well, we're right up against the 8 o'clock hour. Again, thank you both very much for spending this time with us this evening and sharing your expertise. For those of you who've tuned in, thank you very much. Thank you for the outstanding questions, and we hope that you found this beneficial. So thanks again to everyone, and good night. Thank you.
Good night.